current public health reports from the southern cone of South America and the Atlantic maritime corridors indicate a significant surge in hantavirus activity, specifically involving the Andes orthohantavirus strain. This development has gained international attention following a series of severe respiratory illnesses and fatalities linked to regional exposure in Patagonia. The framing of the situation as a total exclusion zone remains a matter of hyperbolic media interpretation, however. Official advisories from the World Health Organization and the Centers for Disease Control and Prevention confirm a localized cluster of high clinical concern. The primary focus of current surveillance is the Andes virus, a unique member of the Hantavirus family known for its high case fatality rate and its status as the only hantavirus documented to facilitate human-to-human transmission. This virus is endemic to the temperate forests and steppe regions of southern Argentina and Chile, where it is maintained in a natural reservoir. The long-tailed pygmy rice rat, scientifically known as Oligorhizomes longicaudatus. +2. In these rodent populations, the virus persists as an asymptomatic infection, excreted through saliva, urine, and feces. Human exposure typically occurs through the inhalation of viral aerosols. Microscopic particles disturbed from contaminated soil, nesting materials, or dusty environments in rural settings. The current timeframe of the surge began in early April 2026, coinciding with the departure of the expedition cruise ship MV Hondius from Ushuaia, Argentina. This vessel, carrying 147 passengers and crew from 23 nations, became the epicenter of an international health response after passengers began exhibiting symptoms of Hantavirus Pulmonary Syndrome, or HPS. Background data from the Pan American Health Organization shows that while hantavirus cases are sporadic, the 2025 to 2026 period has seen a rise in reported infections across the Americas, with 229 cases and 59 deaths recorded in the previous year alone. Viewers should understand that while the global risk is assessed as low, the clinical severity of the Andes strain necessitates rigorous monitoring. The illness progresses from a prodromal phase of fever and muscle aches to a critical cardiopulmonary phase where the lungs fill with fluid, often leading to rapid respiratory failure and shock. The geographic focus remains centered on the Patagonia region, where environmental factors and rodent population dynamics appear to have increased the likelihood of human-animal interface incidents during the autumn season in the southern hemisphere. The core developments of this outbreak are being managed through a multi-agency international coordination effort involving the WHO, the European Center for Disease Prevention and Control, and the CDC. As of May 11, 2026, surveillance data confirms a total of 9 cases linked to the cruise ship cluster, comprising 7 laboratory-confirmed cases and 2 probable cases. The death toll stands at 3, representing a case-fatality ratio of approximately 38%. The timeline established by epidemiologists indicates that the index case was an adult male who had spent 3 months traveling in rural Argentina, Chile, and Uruguay before boarding the vessel on April 1. This individual developed a fever, headache, and gastrointestinal distress on April 6 and died on board on April 11 while the ship was in the South Atlantic. Because the Andes virus can spread through close, prolonged contact, health officials are investigating the potential for secondary transmission among the ship's passengers and crew. +3 subsequent cases were identified as the ship followed an itinerary through remote locations, including Antarctica, South Georgia Island, and St. Helena. One critically ill passenger was medically evacuated from Ascension Island to South Africa, where laboratory testing through polymerase chain reaction, or PCR, and genetic sequencing confirmed the presence of the Andes virus. This confirmation triggered a massive logistics and tracing operation. The MV Hondius was eventually directed to the port of Granadilla in Tenerife, Canary Islands, where the ship arrived on May 10 for controlled disembarkation and repatriation. Laboratory confirmatories are being handled by specialized facilities such as South African Intensive Care Labs and the EURL-PHIRZV in Europe, which provides diagnostic support for countries lacking specific Andes virus testing capabilities. Contrary to early rumors of a forbidden zone throughout Patagonia, health ministries in Argentina and Chile continue to operate clinics and surveillance networks, focusing their intervention on high-risk rural areas and small towns where 75% of cases are historically linked to developed settlements within rodent habitats. The current data reflects a moderate risk for those directly exposed on the vessel and a very low risk for the general public, provided that strict infection prevention and control measures are maintained during the 42-day monitoring period mandated for high-risk contacts. Public health guidance regarding the hantavirus surge focuses heavily on prevention and early clinical intervention. There is currently no specific vaccine or antiviral cure for hantavirus infection. Therefore, the standard of care is aggressive supportive therapy. In severe cases of Hantavirus Pulmonary Syndrome, the use of extracorporeal membrane oxygenation, or ECMO, has been shown to improve survival rates to approximately 80% if initiated early in the cardiopulmonary phase. For residents and travelers in the Patagonia region, surveillance agencies emphasize rodent-proofing measures and specialized cleaning protocols. Official recommendations include the use of a 10% bleach solution to disinfect areas where rodent activity is suspected, rather than sweeping or vacuuming, which can kick up infectious aerosols. Surveillance of the long-tailed pygmy rice rat remains priority for predicting seasonal surges, as higher rodent density often correlates with increased human risk. +2 honest limits of current knowledge include the exact extent of human-to-human transmission efficiency in this particular cluster, and the full itinerary of the index case's exposure prior to boarding. The ECDC has issued scientific advice for the management of passengers, requiring daily symptom monitoring and self-quarantine for up to 6 weeks. This period corresponds to the maximum known incubation timeframe for the virus. Public health officials remain calm but vigilant, noting that while the virus is lethal, it is not highly contagious in casual settings and requires close and prolonged contact to jump between people. As the repatriation of passengers continues, international health focal points are supporting contact tracing across multiple continents to ensure no tertiary cases emerge. The situation serves as a reminder of the critical importance of viral surveillance in regions where human activity overlaps with wildlife reservoirs. We will continue to monitor official statements from the WHO and local health ministries for updates on the containment of this cluster. For more updates on international health security and breaking news reports, consider subscribing to this channel. The operational focus of this international health crisis shifted from regional surveillance to maritime quarantine as the MV Hondius, a vessel carrying passengers from 23 different nations, became a primary site of clinical investigation. According to documents provided by maritime health authorities and the International Health Regulations Framework, the index case involved a 44-year-old male traveler who had been moving through high-risk rural corridors in the southern cone for several weeks before boarding the vessel in Ushuaia. His clinical progression followed the classic, albeit rapid, trajectory of Andes orthohantavirus. Following an initial onset of nonspecific febrile symptoms on April 6, his condition deteriorated into full-scale Hantavirus Pulmonary Syndrome, characterized by pulmonary edema and severe myocardial depression. His death on April 11, while the ship was in transit between the South Shetland Islands and South Georgia, prompted an immediate activation of biosecurity protocols. The subsequent days saw a coordinated effort between the World Health Organization and the European Center for Disease Prevention and Control to track every individual on board. As the unique ability of the Andes strain to facilitate human-to-human transmission through close contact respiratory droplets necessitated a comprehensive isolation strategy. Medical logistics became increasingly complex as the ship continued its scheduled itinerary toward the mid-Atlantic. When a second passenger exhibited similar symptoms of acute respiratory distress, an emergency medical evacuation was coordinated at Ascension Island. The patient was transported via specialized biocontainment flight to a high-security isolation ward in South Africa. It was within these South African laboratories that molecular diagnostics, specifically real-time polymerase chain reaction or PCR testing, confirmed the genetic signature of the Andes virus. This laboratory confirmation was critical, as it allowed public health officials to differentiate the outbreak from other seasonal respiratory illnesses. Furthermore, the European Union's specialized laboratory network, including the EURL-PHRZV, was placed on high alert to support the Canary Islands health services in preparation for the ship's arrival. The technical challenge for these labs involves not only detecting the virus, but also conducting serological assays to identify IgM and IgG antibodies, which help determine the stage of infection and the potential for further viral shedding. While sensationalist reports have characterized the entire Patagonia region as a forbidden zone, data from the Ministries of Health in Argentina and Chile offer a more nuanced, though still serious, perspective. Verified surveillance reports indicate that the surge is localized to specific ecological niches where the Oligoresumes longicaudus population has experienced a mass seeding event, leading to an explosion in the rodent reservoir. Official statements clarify that the risk is not uniform across the territory, but is concentrated in peri-urban areas and rural settlements where human encroachment into rodent habitats is highest. This distinction is vital for international shipping and trade, as major ports in the region remain operational under heightened sanitary surveillance. The arrival of the MV Hondius at the port of Granadilla in Tenerife on May 10 marked the beginning of a 42-day monitoring window for all 147 individuals who were on board. This duration is strictly calculated based on the known maximum incubation period of hantaviruses. During this period, health officials are utilizing systematic symptom screening and isolation of any individual presenting with a temperature exceeding 38 degrees Celsius. The contrast between the verified clinical data and the broader claims of regional uninhabitability highlights the necessity of relying on official epidemiological bulletins over unverified social media reports. In the wake of the documented cluster associated with the Andes orthohantavirus, public health guidance from the World Health Organization and the Centers for Disease Control and Prevention remain centered on rigorous environmental management and early clinical recognition. The primary practical takeaway for residents and travelers in endemic regions of the Southern Cone is the absolute prevention of viral aerosolization. Because the virus is transmitted through the inhalation of microscopic particles of dried rodent excreta, standard cleaning methods like sweeping or vacuuming are strictly contraindicated in potentially infested areas. Instead, official protocols mandate the saturation of surfaces with a disinfectant solution, typically a 10% bleach-to-water ratio, for at least 30 minutes before any manual cleanup begins. This chemical intervention effectively dissolves the lipophilic envelope of the virus, rendering it inactive. Furthermore, the use of N95 or higher-rated respirators, rubber gloves, and eye protection is required for anyone entering long-abandoned buildings or handling agricultural materials where the long-tailed pygmy rice rat, or Oligoresumes longicaudus, may have nested. These measures are not merely precautionary, they are the primary defense against a pathogen that currently lacks an FDA-approved vaccine or a specific, standardized antiviral treatment from a surveillance perspective. The focus has shifted toward predictive ecology. Health ministries in Argentina and Chile are increasingly relying on mast seeding data, phenological events where native bamboo and other flora produce a surplus of seeds, leading to an exponential surge in the rodent population. By monitoring these environmental triggers, authorities can issue targeted warnings months before a potential zoonotic spillover occurs. However, while the Andes strain is the only hantavirus confirmed to move between humans, the exact biological mechanisms and the efficiency of this transmission are still under intense genomic study. Scientists are currently investigating whether specific viral mutations or host factors contribute to superspreader events, such as the one observed during the 2018 to 2019 Epuyan outbreak and the current 2026 maritime cluster. The lack of a rapid, point-of-care diagnostic test also hampers efforts, as the early prodromal phase of hantavirus infection is indistinguishable from common influenza or other febrile illnesses. often leading to delays in the life-saving application of extracorporeal membrane oxygenation, or ECMO. The ethical dimension of reporting on such outbreaks requires a delicate balance between public safety and the prevention of regional stigmatization. The characterization of Patagonia as a forbidden zone is inaccurate and complicates the essential work of local health officials by fueling unnecessary panic and economic disruption. A responsible public health approach acknowledges that while the risk of Hantavirus Pulmonary Syndrome is statistically low for the average person, the high case fatality rate necessitates a high degree of vigilance for those with specific occupational or recreational exposures. Clinicians emphasize that early triage is the most significant